Welcome to the AQA YouTube channel. To navigate through the video, you can select specific chapters or subjects of the video. Enjoy watching and remember to subscribe. I'm Peter Van Benthen from AQA, and we've got Georgina Florentino here as well, Naz Erdeman, and we've got the Department of Health with some champions from COVID and also some good advice about COVID-19 and some booster shots and lots of good information that we're just going to share today on a fairly informal basis, but so we'll keep it fairly loose and just use it as a discussion topic. At the end, we'll have lots of questions or answering time. So at the start, we'll just have a bit of a presentation from Martin Heng and Dr. I'm sorry, could you please introduce yourself?
Hi, everyone. My name's Laxmi Iyengar. I'm a doctor. I work in Hawthorn, Victoria. And it's my pleasure to talk to you today as a COVID clinical vaccine champion about COVID-19 and why getting the third dose is important to keep us all safe today.
Excellent. So I really look forward to this presentation today. Any information is good information because, you know, sometimes it's fairly mixed, the information that we get, and online presence sometimes has misinformation. So this will be good today, and it's a great idea setting up COVID champions so we can target groups like ourselves and have a bit of an awareness session. So that's great.
Thank you.
We've also got Martin Heng, who's a disability vaccine champion. Welcome, Martin. If you'd just like to say hello to the group and a little bit about yourself as well.
Sure. Yeah, Martin Heng. I have a C4-5 incomplete spinal injury. I know a few of you. I saw Gary somewhere around on Gary Hopkinson. Hi, Gary. And some of you others may know me. Vaccine champion. Basically, yes, I put my hand up to be a vaccine champion for the Department of Health. Basically, so they've kept me in the loop with what's been going on with the rollout and what's all the developments. And I've been called upon a couple of times just to speak on behalf of the department, just to kind of basically encourage people to get vaccinated and to tell my story. So that's what I'm here for today.
Martin, do you have a spinal cord injury?
Yep, C4-5 incomplete. I said that up front, yeah.
Oh, excellent. Sorry, I missed that.
No worries.
So shall we start the presentation? That'd be great.
Yes, just wanted to check, Laxmi, do you have the slides and would you like to share your screen?
Sure, I'll do my best. So firstly, before I start talking about COVID, I'd just like to acknowledge the traditional owners of the land on which we're meeting today. I'd like to pay my respects to elders, both past and present, and extend that respect to any Aboriginal and Torres Strait Islander peoples that are here today. Next slide, please. So as you all may know, there are 3 vaccines that are currently approved in Australia. There's the Pfizer and the Moderna, which are both mRNA vaccines, and these are both offered to people over 12 years of age. The Pfizer is recommended at a 3-week interval, Moderna 4 weeks. And these 2 vaccines have also been approved for children, so for children aged 5 to 11. And for children, it's a lower dose, a third of the dose that the adults get, and 8 weeks apart as well. And both of these vaccines can also be given as a booster as well, but for pediatric population, they haven't encouraged the booster just yet, but that may happen in the future. There's also the AstraZeneca vaccine, which is a different type of vaccine, which uses a viral vector to give the COVID information to our body so that it can make antibodies. AstraZeneca is given at a 6-week interval. And the booster dose, however, that's recommended is generally Pfizer, regardless of whether you've taken AstraZeneca or not. But you can be given an AstraZeneca if, for some reason, you cannot have Pfizer or Moderna after the 2nd dose. Next slide, please. So as I just mentioned, this slide's probably a bit repetitive. So anyone aged 5 years and over is eligible to receive the Pfizer and Moderna vaccine, and anyone over the age of 18 can receive the AstraZeneca. To book your vaccine, I found it really easy to book online. That's the method that I used to get my very first Pfizer vaccination. I believe you're getting a copy of the slide with these numbers and email and websites to book that information, or you can take a photo of the slide if you want to. Yeah, and also a lot of the information that you're getting today is information on accessible clinics for people with disabilities in order to receive the vaccination suitably. Next slide, please. So why is the third dose important? So unfortunately, what all the data points to so far is that unfortunately, people that have passed away from COVID or people that are really sick in hospital because of COVID are those that are not immunized in general, or people with very severe comorbid conditions. There's also really good evidence to suggest that after about 6 months of just receiving the second vaccination, the immunity wanes. And for some reason, this is more common in older Australians over the age of 60 for reasons that we don't know. So what the data shows so far, especially from countries like Israel and the UK, is that the third dose will help maintain protection against COVID-19 and help keep Victoria safe. So the 2 initial doses are very, very effective at protecting severe disease. But the third dose, like I said, it really, really boosts that immune response just as our antibodies are waning, so that we get that exponential rise in antibodies to fight COVID. So a third dose increases your protection against infection with the virus that causes COVID-19, against severe disease and dying from COVID. And the statistics really, really support this evidence. And the third and fourth doses will be free for everybody. Next slide, please. So this is a question that I get asked often as a doctor, whether people should still receive vaccinations if they've had natural immunity to COVID. And the answer is absolutely yes, they should have vaccination. What we recommend, however, is that they receive the vaccination after the acute phase of the illness, which is typically 2 to 3 weeks, and after they've been cleared from their isolation, which at the moment is 7 days after a positive test for COVID. So you will get some immunity from having the infection naturally, but definitely it's not going to be for more than 6 months of having COVID itself. So the bottom line is, yes, despite having COVID in the past, you should still get the booster. Now, reasons to delay COVID vaccination after having COVID. I think everyone with a severe disease should discuss it with their own GP, because it's all relative, isn't it? It's quite a subjective term, what's severe and what's not in some cases. So people with multi-system inflammatory syndrome should delay vaccination until 3 months. And people who've received monoclonal antibodies therapies or convalescent plasma should delay vaccination for at least 90 days. So after these have been administered. So if you think that's you, definitely chat to your GP, but I would recommend COVID vaccination as soon as possible, as soon as someone's feeling better, which is typically after 2 to 3 weeks. Next slide, please. What vaccine should I get for my third dose? So you've probably heard in the media that combining the 2 vaccines, so for example, if your first 2 doses were AstraZeneca, that it's good to receive the Pfizer and that boosts the immunity even further, yes. I had the Pfizer myself, and I've had all 3 of my vaccinations, so the first 2 as well as the booster Pfizer. So basically, if you haven't had your booster shot booked in, I highly encourage you to book it in now and to check whether you're eligible or not. You can find the data on your Australian immunisation record or checking your COVID-19 digital certificate. And you can get either Pfizer or Moderna, regardless of what you got for your first 2 doses. And you can also get the AstraZeneca as the 3rd dose if you want. For example, if you did have a contraindication to getting Pfizer or Moderna. And you can also get the 3rd dose if you've completed an initial vaccination course overseas with a COVID-19 vaccine that's recognised by the TGA. And if you're not sure, again, talk to your GP for your specific situation. Next slide, please. For those individuals that are severely immunocompromised, we definitely support the booster vaccination, but we also suggest that you can even get a 4th dose, and that's eligible for walk-ins or book-ins online. So any people over the age of 12 with certain conditions and therapies and that are severely immunocompromised can get a 4th dose to support their immunity. Next slide. So as you probably know that under the new pandemic orders from the 12th of January, workers in the key sector are required to be fully vaccinated, and that includes the healthcare sector for myself, as well as people in aged care, disability, emergency services, correctional facilities, quarantine accommodation, and food processing and distribution workers. And all workers must cite and record proof of their vaccination. And this does not apply to workers who have a valid medical exemption, but that would be very few. I certainly haven't provided a medical exemption to anyone myself. Workers eligible for a 3rd dose before the 12th of January will have until Saturday, the 12th of February to get their 3rd dose. On the advice of the Victorian Chief Health Officer on the 23rd of January, it was announced that school staff must receive a 3rd dose by the 25th of February 2022 if they are eligible. Next slide, please. So as a GP, this is a common question that I get asked when I immunise people, you know, doctor, will there be side effects? And what I really want to emphasise to people is that side effects are not the same as adverse effects. Side effects are good. That shows that the vaccine's working, it's making antibodies, and when it's making antibodies, there's a little inflammatory response in the body, which is why you get mild side effects such as injection site tenderness, tiredness, headache, muscle pain, joint pain, fever, and chills. I got side effects for the booster myself. It lasted for less than a day. The next day after the booster, I felt a tiny bit lightheaded, a little bit nauseated, but that resolved with a single dose of Panadol, lots of hydration, and lots of chocolate. So the most common adverse event reported to the TGA following the 3rd dose is surprisingly swollen lymph nodes. I have seen a few patients with swollen lymph nodes, and what I've done is reviewed the patient after 2 to 3 weeks, and in all cases, the lymphadenopathy has been resolved. So for the Pfizer vaccine, it occurred more frequently after the 3rd dose in about 5% of the people, and a bit less, 1% of the people in the 1st and 2nd doses. And for Moderna, this occurred in up to 10% of the people. But like I said, these are just side effects. These are not adverse effects, not reasons to worry, not reasons that require a medical consultation unless you were particularly concerned that you were unwell. Next slide, please. So now I'd like to talk about supported access to COVID-19 vaccination. So if someone is unable to get vaccinated by their usual support networks, disability liaison officers can assist them to make suitable arrangements. So to contact a DLO, you can complete a form online, or please take a note of that email address, which, like I said, you'll get a copy of these slides. So that'll have some of that information on there. So we really want you to get vaccinated. We really want you to protect it. So we will do everything we can to facilitate this for you. Next slide, please. Now, we're very fortunate to live in a country that we can, have COVID-19 vaccination at home. So if you've got an injury, a chronic health issue or frailty, you're unable to go outside for any reason, please call the number. There's a COVID-19 hotline, 1-800-675-398. And there's also an interpreter service that we can provide. So we can arrange to have the COVID-19 vaccination safely given to you at home. And again, to contact a DLO, please fill out the form or email on that address provided on that slide. Next slide, please. There is some resources to help guide you. I'm not even going to attempt to read this, but please take a photo. And if you need any specific resources, I'm sure we can help arrange for that to be delivered to you if you need to. Next slide. Thanks, everyone. Thank you for listening to me.
Thanks for that presentation. That was really good. Some good info there that I wasn't aware of, and some great contacts with phone numbers. So again, Georgina will get that and share that amongst the group today for people who have joined us online. So that'll be really good to share, because there's some great contacts for to find out ways that if you can't get in to get your COVID shot, you can be backed up in other ways. It's really good. Now, Martin Heng, do you want to talk about your position?
Sure, sure. Well, due to my age, I'm just about to turn 60 this year, and due to vaccine supply, I had no choice but to get the AstraZeneca when it was first available, when it was first rolled out. So I had AstraZeneca, and I actually was very lucky. My local GP was one of the clinics, one of the medical centres that was offering vaccinations. So I just went to my doctor, my regular doctor, and it was great. Went in, very easy, and the first one, I did have a side effect. I had a very, very sore arm for a good week, but it was just like a bruise. But that was the only side effect I had, and that was the first shot. The second shot, I had no side effects at all. I think I had a sore arm for half a day, but nothing like the sore arm I had the first time around. And the third dose, I had read up on this, and I had read the advice was to make it was advisable to mix and match. So whatever you didn't have the first time, try and get different one the second time. So having had the AstraZeneca, I wanted to get an mRNA, which is either the Moderna or the Pfizer. And luckily enough, my pharmacy, who I know very well, I've got an account with them, as many of you will have accounts with your pharmacist, and they send my meds down for me whenever I need them. And it's a 5-minute roll up the road in my wheelchair, and I just made an appointment with my local pharmacist and got it done very, very simply, and had the Moderna, and I had 0 side effects from that. And all I can say is there's a big shout out to the Victorian government, because they've made it so easy to get vaccinated. There's not only all the wheelchair accessible vaccination centres, we've got this system with the DLOs, disability liaison officers, and I know numerous people who've been in touch with the DLOs to help them either book a vaccination or indeed get someone to come into their homes. And I know a number of people who have, for various reasons, had somebody come to their home to get vaccinated. We are indeed actually very lucky to have this system in place. So I praise the Victorian government for actually putting these DLOs in place and putting this in place that people can get vaccinated at home, because there are a lot of people who are actually scared to leave home for whatever reason, and that may be very valid reasons for being scared to leave home, particularly with COVID running so rife at the moment. So I would urge anybody who has any kind of a hesitation at all to get in touch with a disability liaison officer and work out really what the best way for you is to get your vaccination. And if the best way to get it for you is to get it at home, then organise getting it at home.
I had very similar, sort of went through a similar process, Martin, but I must admit at the start I was a bit nervous about getting the COVID vaccine just because of the misinformation that was out there. You know, it was a lot of hype about it, of course, and it all started, well, you know, back a couple of years ago now, and you really didn't know what to do. But because, you know, in my case, you know, I didn't really want to get the vaccine, but that was better too, because, you know, then I listened to the science and not what was being said online and what the misinformation. And the news was sort of over-reporting about it too much. But the first COVID shot I had was AstraZeneca, and that was sort of gave me a fever and made me feel off for about 24 hours, and the second was fine. And then I recently, between Christmas and New Year, had my booster, and that was the Pfizer. And the next day was a really hot day, but I was a bit cool that day, so I put it down to a reaction. You know, I thought I want to put a jumper on, but it was 30 degrees, and I thought, oh no, I'm having a reaction. So now that I thought about that, I thought, oh no, it's fine, just having that slight reaction. But you know, I feel much better that I am protected, and everyone has their own reasons, or they do or don't. But the main thing that really helped me to make that decision was having a good chat to my doctor and listening to proper science. And I really get why some people do and don't, and they have their reasons. But after you have a talk to your doctor and find good information, not the misinformation, and that's hard to tell sometimes. But you know, I also respect all views as well. Yeah. So Georgina, maybe you can tell us a little bit about your Pfizer, your shot, and what was a bit different for you. Yeah.
Yes, both my first and second doses were Pfizer. Reactions were very mild, just a few aches and pains and sore arm, of course. But the booster shot was about 3 weeks ago now, and I did feel a little bit off with that as well. I had a few muscle aches and pain. I felt very tired, and the sore arm, and yeah, like the doctor just mentioned before, one Panadol did the trick. And my husband had the booster shot as well the same day, and he didn't take a Panadol, and he had to sleep all afternoon. But I was fine. I was able to go play badminton that day. So yeah, so definitely taking a pain relief tablet helps. So yeah, it was only just a day's worth of symptoms, so pretty happy about that, and I'm glad that I went ahead and took all the vaccines. And yeah, I feel protected, as Peter mentioned. So yeah, so we're still protecting myself out in the street with masks and, you know, practicing social distancing still. But yeah, I still feel protected that I've had my third dose. And also going back to my original first dose, I was hesitant. I have an immune system issue. I've got lupus, and so I was very concerned on how I was going to react. But thankfully, my specialists convinced me to take the vaccine because getting COVID was so much worse. So yeah, so that's my story.
Thanks for sharing. Yeah. So, but thank you very much for this presentation today, Dr. Laxmi and Martin and Joanne in the background flicking the slides. Thank you. It was really good to hear, and we love to share these slides with the general public. So send them through, please, to email, so we get, because there were some good contact details on there, you know, for you know, the champions, or, you know, direct information to have and know, and also contacts to find out how you can get vaccinated, and if you need support to get vaccinated. So look forward to receiving that.
So I've noticed in the chat box, no one's asked a question, or maybe there aren't any questions, and both both Martin and Laxmi have been able to provide all that information with the slides as well. Thank you, Joanne, with the slides. So if anyone wants to ask a question, if they could write it in the chat box and I'll read them out. Looks like everyone's content with the information.
Excuse me, Georgina, some people like myself might not be able to be easily typing into the chat box, so perhaps they should be allowed to speak up if they can't type.
Yes, absolutely.
Yeah, that'd be great.
Could I ask a question, please, of Laxmi? She mentioned about swelling of the lymph nodes. How would you feel that? It's just for general information for when other people talk, when we're talking generally about amongst other people. Where would the lymph nodes swollen and how would you feel them?
So I've seen a couple of people with this. So the lymphadenopathy can actually occur at any site in your body. So we have lymph nodes everywhere.
Yeah.
The lymph nodes contain B cells, which are the cells that make antibodies. So I've seen people with swollen lymph nodes just under their arms, so in their armpit. But I've also seen people with lymph nodes in their neck, just above their clavicle. And I've also seen someone with a lymph node at a distant side in their leg. So regardless of where you find it, what it typically feels like is a little round swelling. And the important thing is that when you first notice it, if it happens, if you notice lymph nodes at any time, is that you make sure you monitor it. So go see a doctor. Lymph nodes can be swollen for many reasons, some not so good reasons, which we don't want. And typically those lymph nodes feel very different. They're quite hard, quite rubbery. And typically, if they're swollen for reasons that are sinister, they're not going to go away. So with Pfizer immunization, what I found is that if the patient gets lymph node swelling, it typically happens in 2 to 3 weeks. And it typically lasts about that duration, 2 to 3 weeks. So a very important thing to do is follow up. So if you ever do notice something like that, you just make sure that someone sees it, someone has a feel of it, and that it's getting smaller and it's gone. But persistent lymphadenopathy is not a normal thing, and you should definitely see your doctor to make sure that you review that.
Okay, thank you for that.
That's okay.
There was a question from a Michael Taruli. He said he's got the Moderna. He got the Moderna booster after 2 AstraZeneca vaccines, and he's asking, is the Moderna better than the Pfizer, or does it not matter?
They're both quite comparable because they're both mRNA vaccines, so quite comparable together with the AstraZeneca, which is a different vaccine with the adenoviral vector, so it's comparable. And if you've got the Moderna booster, that's fine, that's a good thing. You've got the booster, that's the main thing. And the AstraZeneca itself is a very good vaccine as well. I mean, unfortunately, it has received a lot of bad publicity because of the rare, the TTS syndrome, but it is a very good vaccine too. So you're well protected. That's the main thing.
Has anybody else got a question for either Dr. Iyengar or Martin?
I'll probably a follow-up on that question, Laxmi. With the Moderna, I didn't get any reaction from the third for the booster. Is that is that a concern, or is it?
No, not at all. Not a concern. So not getting side effects is not a concern. You probably had, your body recognized the COVID straight away, and you probably just had a mild inflammatory response. So it doesn't mean that it hasn't worked. It's no reason for alarm. Yeah.
Okay, thank you.
That's a good point. That I was actually thinking that myself.
Yeah. When I had my vaccines, I had the sore arm for the first dose, but the second dose, I felt very little. And most people were shattered after the second dose, but I really felt the booster.
Same here. Doctor, I was wondering, could you talk about the possibility of a fourth vaccine?
Yes. So currently it's recommended only for severely immunocompromised individuals. So what will happen in the future with regards to everyone, we shall see. I mean, COVID's still very new to everybody. So we're still figuring it out as we're going along. But at the moment, the fourth dose for just the severely immunocompromised people, not everybody yet.
Okay.
Because some people can't mount an antibody response as well as others. And some people have syndromes where they can't do that. So for those individuals, a fourth dose might be very beneficial, but not everybody will need that, which is the vast majority of the population.
Hello, Dr. Laxmi. I'm Nas from AQA as well. Just got a couple of people here at the Royal Talbot. Question is, originally the third dose or the booster shot was made for, I think, 6 months after your second dose. And that's been boosted by a few weeks over the last few weeks.
Correct.
The question is, why is that? Is that changing because of new research that's been coming through? Or is it just being made up because we think it might be better for different reasons?
No, I mean, it's with good reason. Everything that the Department of Health does, it's with evidence-based research. So even though we're figuring it out, what we want to do is do it slowly. So we did it at 6 months, then we shortened the duration. So I guess it's to monitor, reactions, side effects, things like that. But also it probably has a lot to do with supply as well. Yeah. So from a safety point of view, I mean, it's going to just stimulate your immune system, and that's the whole point of the booster. So even after 3 months, the levels of your antibodies are going to slowly decline, which is more pronounced in older people. So getting that booster is just going to further support that exponential rise in antibodies, which is exactly what we want. And exactly what we want at a time like this when there's so much infection around as well.
Oh, great. Thanks for that. We actually had like a whole bunch of questions, but both you and Martin answered our questions along the way. So good presentation, and you answered our questions before we could ask them.
Thank you. Thank you, Naz.
There's one question from Young Ok, who said that she actually had a booster quite early in the middle of November, and she's asking if she needs another booster now that it's almost February.
That would depend on her personal situation. So if she falls into that category of being severely immunocompromised, then possibly, but she should check that with her GP. Yeah. But if she's had the booster, and if she's not severely compromised, that should be okay for the moment, given she's just had it in November.
Okay.
It's probably worth keeping an eye on official health announcements.
Absolutely, it's changing all the time.
It changes all the time. And to be fair, I mean, we've all got used to having annual flu vaccines, and it's something that I think it's something that we need to be looking forward to with COVID as well. It's just that it will be an ongoing process, just like the flu vaccine. So sooner or later, I think the government will suggest, you'll get your boosters after certain lengths of time. So, just encourage people to kind of keep their ears open to the official health announcements.
Yeah, I think you bring up a good point, Martin. This sort of is the new normal, as we're turning into the future, because, we have to vaccinate our way out of this, unfortunately, and that's the way it is, which, to lessen the whole impact that it has across the world. But we encourage any questions, and no question is silly, because, we need to know and feel comfortable with the vaccine. We've got some experts here. So please put that through very soon, because we're about to wrap up this half of the presentation, and we'll go into the other parts of the presentation of the meeting today. But at the moment, we'll just stick with the COVID-19 information for a couple of minutes. And if there's no more questions, we'll close this side. But thank you very much so far from our guest speakers. Any more questions, Georgina, I think are popping up?
It's not relevant to COVID though. Just wondering what you would foresee this year being like with regards to the flu. There's probably, I don't know, if people are starting to take their flu vaccines as well. This is about, next month or so is when usually people start taking it, for the winter months.
And actually, that's a great question, Joya. Maybe we can hear a bit more on that. I heard there's a vaccination combining both COVID and flu coming up pretty soon. I think they can't do that at the moment, but it's not too far away.
And all of those things that we're doing to help avoid COVID, like the social distancing, the hand hygiene, the mask, all of those things are actually helping the flu as well, which is why we had so few deaths from the flu itself last year. So, so all of those things are going to help both COVID as well as influenza.
That was a good point there, because, last year, because we've changed our pattern so much, washing hands, wearing masks, a silver lining to this, just by thinking about this, what we're all doing and how we've changed, it has really changed how the flu and influenza and COVID is reacting in the community, and just by doing those simple things, we've all got better at that. And those numbers have been very low last winter.
Yeah. But what people shouldn't get confused is the two immunizations are completely different. So COVID-19 protects you against coronavirus, whereas influenza is influenza virus. So completely is something different family altogether.
I like any of those families.
Yeah.
But have we got any more questions coming through, Georgina?
No, that's it. I think the presentation was fantastic, and yeah, you've answered a lot of questions all in the one go. Fantastic slides, and I will share them at the end of the meeting to all the people that have joined today. So yes, thank you so much.
Great presentation. Thank you very much from the Department of Health, to Martin and Dr Laxmi and Joanne in the background. You got it together very quickly for us, and it was great. So we've got some good info, and sort of Georgina and I are going to do another presentation next week, and we've learned so much. We can even share the slide sheets with those guys, can't we, Georgina? So it's great info. Thank you. Yeah.